Well, and yeah, I get guys that reach out to me all the time and they say, how I want to teach, I want to do the things you're doing and kind of put good stuff out there. How do I increase my following? And I say, I have no idea. I am a fluke of the algorithm. I had no social media before this. I was completely content to die in obscurity. That was my thing. And I had one video go viral that was a joke I made for like 5 friends.
Right. And you didn't think that anyone besides maybe 3 of those friends would see it, right?
No, I did not. I went in to do an infusion on a patient. I think it took about 4 hours because of what we were doing, some electrolytes and some various different chemicals that are kind of tough on the body. So you have to kind of gently ease that stuff in. Sure. And when I walked back out, I checked my text messages to see if my friends had sent it to me. And you know how you kind of click on your own stuff to watch it, to proofread it, so you can decide whether or not you want to take it down, because I'm super self-conscious. Sure. And it had like 30,000 views in 4 hours. And it was
wow.
What the hell just happened? It was scary, but that's life, right? What you don't expect is what's coming. So
I watch a lot of people who, they don't get a ton of views and stuff like that. And they have one that gets to like 500 and they're super excited. And it's just like, when you have one get over that like 100,000 mark, it's like, that's a lot of people watching me. And it's like, now where did I screw up? And it's the whole
right.
thing.
I fortunately, I'm somewhat, what's the word? Psychologically armored for that, because I've been a musician for a long time. So I've played live and made mistakes. So, every time you inflict a wound, whether it's psychological or physical, it hurts a little less. You get a little more used to it. So I'm okay with that. But if I had just started zero to try to, zero to famous, so to speak, I think I would have shut it down by now. If it weren't for the people that tell me, you changed my perspective. Thank you for saying this in a way I hadn't thought of it. Or I had a patient with the same thing, and because I saw this video, I was able to catch that and do well for that person. That's what keeps me going, because you guys know it's murder out here. I mean, people view you as an avatar. They lose all ability to see you like a human being. And when they get in those comments, bro, they cut deep. You know what I mean?
They do. Now, have you I'm sure you've been told that you have a very soothing voice.
Yeah.
By some people are tired of hearing me talk. So
I think that it's very comforting. If you were helping me in healthcare, I would think that would be comforting.
Thank you. And I do sort of employ it in that manner when I'm dealing with people that have a lot of anxiety about whatever's going on. One of the weird things about the human brain, we're not unlike other animals, but we're like very few other animals in that our pain centers are connected to our anxiety centers. So we go into distress when we feel pain and discomfort, whereas simpler creatures, say like a lobster senses damage, but it's like a Terminator. It's like, oh, okay, I don't have a hand now. That's going to be somewhat inconvenient, versus us, we kind of freak out. So I try to utilize that. It's like anything else, the talents that you have in life, it's like opening a toolbox somebody gave you and going, all right, I'm going to make the best out of what I've got here and try to help as many people as I can. I think that's what most real healthcare practitioners do. I think a lot of people get into it for the wrong reasons.
Yep.
What made you get into that career?
I don't know. So I'll tell you the story, and it's not going to have a ton of details because there really weren't any. So I'm like every other kid who watched 9/11 happen on live TV. I was 17, and so we declare war. We go do our thing, and I decided that I was, I've always been a patriot. I've always believed in America and Americans. I think there's a lot of diversity on how we think we should exist, but like at the end of the day, I've always believed that if we come together, we're good people. And so I've always believed in my country for that reason. And as a young man, I was very motivated. So I joined the Army and became a medic. I wanted to be able to do the things that medics did. And I did 8 years, at that, a couple of deployments, did some time in the combat zone. They give you all the ribbons and the things when you do the dumb things. And I was hooked probably 6 months in. Wow. 6 months in, I had taken care of some people. I had made some people feel better. And I think in a lot of ways that healed the parts of me that were broken. And I I was addicted to it pretty quick, and now 20 years later, I'm 39. I could see me moving to different places in healthcare, but I'll never get out of it. It's, I'm going to work till lunch on the day of my funeral, because if I can sort of help one more, that's what it is. I think people, and I'm sorry, the fire alarm's going off in my local town if you can hear that, but I think some people have an innate urge to help others.
Yeah.
And
right.
I think they're built for it. And if you'll sort of obey that, if you'll give yourself permission to just drop your ego, you don't have to be cool. You don't have to be this or that or the other thing, and just help another human being. I think they live more fulfilling lives. And I think a certain amount of that's just genetic, because I see it in my daughter, and she's 9, but I see it. She was 4. We took her to the doctor when she was sick. She went into the waiting room. She picked out a Tory and brought it to every other child in the waiting room at the pediatrician. And then she picked one for herself. And I told her mom, I said, that it's in her. That's it. That is genetic. We did not teach her that. We've not had time to teach her that. She's not been to school, nothing like that. So if you have that in you, just because people might be watching, if you have that in you, obey it.
Right.
You will live a better. There is no amount of money or possession that will replace that.
I agree.
It's true fulfillment. And it doesn't matter how you help them. You don't have to hold a knife or a needle or have a commanding knowledge of pharmacology. You don't have to. Just help people. I think there's a reason that triggers the reward center of our brain. And I think we've forgotten that as we chase dopamine and we scroll and we do all these things,
Where do you start off whenever you go into the Army and it's just like, I'm going to be a medic? Do you just start doing grunt work and work your way up as you learn, or is there a system to that?
System would be a strong word. So, and bearing in mind, I joined 20 years ago in 2003. So, but at the time, you take your ASVAB, they see what you're good at. And I did well because I was one of those self-study kids anyway. I had no use for homework or school, but I would just read volumes of books because I just wanted to know things. So our little placement test called the ASVAB, I did well on it because I had just general knowledge of a lot of things. And then I come from a family of mountaineers, from Appalachia. So you just learn how to do everything yourself, whether it's welding or building or sewing your own clothes together. You just do that. That's just a thing you learn as you grow up. So they told me I could have any job I wanted, and I selected medic. And you go to boot camp first. Like everybody else. So everybody goes to boot camp unless you're already a doctor or something, and you get like special stuff, right? So you learn all your infantry stuff, and you learn how to blow things up, and you throw grenades, and you shoot machine guns and rocket launchers, and it's a blast. I mean, don't get me wrong, you're an 18-year-old kid with the coolest firecrackers ever.
Right.
And then just violently it changes. They throw you on a plane after you graduate, and they send you to Fort Sam Houston in Texas for this incredibly intense program with a 53% attrition rate. So within like the first 2 days, you're CPR and AED certified. Within 3 weeks, you're EMT certified. At the time, you went to class 6 days a week with study hall on the 7th day. So you'd spend between 8 and 10 hours a day in there.
So it's very fast tracked, it sounds like, extremely. So you have to be on point mentally and physically.
Oh God, yeah. It's 53 college credit hours in 16 weeks.
Wow.
Yeah, it's a monster, but it's great, And then from there, as soon as I got home from that, I called my recruiter because he was the only person I knew. I had not been to my unit yet because I was a reservist, and my reasoning was I could go to war and come home instead of just being off anywhere in the world, kind of the way the regular Army does. Yep. He put me in touch with the people, and I volunteered to go to Iraq. And when I hit boots on ground there, I was a really good newbie. You know what I mean? Like, to put it in proper context, but I was also a sponge. And that's where it really began to pick up for me. And I began to develop autonomy and began to be held responsible at a higher level than the average medic. And then shortly afterward, when I started working with the Iraqis, I have sort of a penchant for languages. So I picked them up fairly easily, word of mouth. And I started learning the Levantine Arabic that's spoken there.
Wow.
It's fun. It's fun. Man, again, we kind of talked about how random things happen to you in life or how you don't get to choose it. I sat beside a guy in science in 9th grade whose mom was from Texas and his dad was from Michoacan. And he said, I could teach you to speak Spanish. And I said, well, shit, let's see. And, that summer I worked for his dad on the job site, fluent in Spanish, just
Wow.
because he would talk to me, so, which is great in medicine, by the way, because when you can take someone who's, say a new immigrant, they're frightened, they have no idea what's going on, they just had a car crash, or maybe they have a medical ailment or whatever, and everybody's saying all this stuff they don't understand, and then you can walk in and communicate with them in their native language, in their native dialect, like the calm that washes over them. That's better than anything I've got in the drug box, I promise you that.
How did your family feel about you at the age of 19, joining and going over there?
My mom didn't talk to me for 3 days. My
I bet.
dad, by then my dad knew that, when he gets something in his head, there's just nothing that can stop him. I'm stubborn to a fault.
Right.
Like if you were to call me a jackass, it would be a literal thing. But when I'm convinced I have to do something, I just do it. And I have kind of an axiom that I came up with years ago that says if the goal is important enough, the obstacles just don't matter anymore. So
I love that. I love that.
well, and it was my way of justifying what I will put myself through to do what I want to do.
Right.
Once I've made the commitment, I kind of have this thing in the back of my mind that just says I will not be defeated. And sometimes it's a bad thing. It's put me in the hospital, but it's just one of those things that greatness can only be achieved through suffering. So sometimes that suffering happens to us. Sometimes we bring it on ourselves,
Right.
maybe willingly or unwillingly. But at the end of it, if you will pull all the lessons out of it, you can do more than you could have done beforehand, and that kind of ties into one of the reasons I'm such an advocate for the people in recovery, because they have walked a road that so few human beings understand, that just their strength of character and their ability to help another person through is so far beyond what anyone gets out of just an education. I watched a video the other day on, should substance abuse counselors be someone who's always been sober? It was something to that effect. And I don't know. I can't answer it definitively, but I can tell you that if you've been through it and you can identify with that person, I think that makes you a better, stronger counselor.
That was kind of my biggest thing with that video is you need people who can relate. Of course, you have to have people who can relate. And the good thing about someone who hasn't ever experienced that, like we get in our heads and we're like, oh, I'm only anxious because I'm an addict and stuff like that. And the person who's never experienced that can tell you, no, everybody would be anxious about that.
Yeah.
So it kind of levels you out.
Well, and people don't understand, especially in healthcare, which is really sad to say, but I mean, if we're calling things what they are, people really don't understand chemically what goes on in the brain of someone who's detoxing, or
Right.
whatever word you want to understand. Your adrenaline is through the roof. Receptors that have been asleep for years are now on fire. There's anxiety. There's like a loss of touch with reality almost, where you think, am I in my own head? Am I crazy? And you have nothing to grab onto. So it's not like you're fiending for a cigarette. You know what I mean? I quit smoking years ago because I'm from North Carolina, where everybody smokes, right? So it's not like you just want a cigarette. Your entire brain is screaming in every direction possible. And that there's this one thing that'll calm it down. And you'd be surprised what you can talk yourself into when you're in that amount of pain, because it is torture.
Right.
That's the reason people give false confessions under torture. It is torture.
Yep.
when you're going through that. So
Now, how much addiction did you witness when you were in the art, like overseas and stuff like that? Because I'm sure that there was people that wanted to do those jobs, succeeded with the schoolwork and all that, but were struggling.
the largest part of addiction that I ran into was actually after the Army, when I started to interact with the VA system. And
Yeah.
a lot of it had to do with, I don't want to broad brush every provider in the VA, right? There are good people there. There are also bad policies. And
Right.
a lot of it, I think, is directed at a soldier or a former soldier or former Marine's behavior and not how they feel, right? Because they don't want headlines. Soldier with PTSD goes on shooting spree, right? They don't want that, right?
Right.
And, I had issues with the things that I saw, and I went to talk to some people and do the things, and they threw the pills at me, and I said, I'll make you a deal. I'm going to take these for 30 days. we're going to have an appointment in 30 days. When I come back, I'm going to tell you whether or not I'll continue to do it. And it was a nightmare. I didn't like it. It didn't fix anything. I was still excruciatingly unhappy. I just wasn't motivated enough to do anything about it, which was nice and safe for the Washington machine and the war they were waging and all that. So, some of my friends, though, especially in terms of pain management, you know, the VA used to just throw opiates at you. I mean, in ridiculous numbers, Vicodin and methadone and OxyContin and just
Like 20 years ago, though, right?
well, yeah, well,
15, 20 years ago.
yeah, in the early 2000s, and then moving into the early 2010s, when I like separated all the way from service, I still saw it. I do feel like they've peeled it back now, but not out of any sense of doing better by people, just out of the federal mandates that are coming out of Washington right now, because they need public perception to be, you know, they need people to perceive they're actually doing something because the election year is coming up, you know. And I hate to make it so simple, and it is nuanced and it is very complicated, but you know, at the end of the day, you broad brush an entire population. You have patients who don't get what they need. You have people who are addicted, who trusted you, who said, hey,
Right.
if you tell me to take these pills, I understand. And now they're having, you know, crazy amounts of anxiety and withdrawal and seizures and all these things, all because they did what their doctor told them. And when you do everything right, that's not supposed to happen, right? That's not supposed to be how it goes, but it is.
That's like our friend Natalie King that was on the podcast. You know Natalie?
I interact with a lot of people on TikTok, so it's hard to keep track. And I watched a couple of your guys' stuff. I want to say I saw the episode with Natalie.
Okay.
Like her first exposure was completely through the medical system, right?
Correct.
Yeah.
Yep.
Her husband had passed away in active duty, and they brought Xanax to her bedside.
Yep.
That was my biggest thing too. Whenever, I mean, how I got hooked on pain pills, my doctor, who I trusted, gave them to me because of an injury, didn't overtake, didn't anything. And once I said, hey, I think I'm good, I just quit taking them. The doctor didn't give me any information, nothing. And all of a sudden I was in withdrawal and was like, I don't know what's happening to me right now.
Yeah. Yeah. It's scary, isn't it? You
Yeah.
know? And I've been there, you know, and that's one of the reasons I have empathy and sympathy for the people that are addicted, which I'm kind of ashamed to admit, because I should feel bad for anyone who's going through anything if I want to call myself a healthcare practitioner, right? But there's something about the human brain. Our sympathy or our empathy really is only available when we can see it happening to us, right? Only then do we truly put the shoe on the other foot and go, oh man, that's so terrible. And then we start treating people like human beings. That it's a very sad part of who we are. It's one of the reasons I do the advocate stuff on TikTok and talk to people about, you know, that, like the one video said they need that pain medicine. It's not up to you to understand what they're going through, nor is it up to you to decide whether they deserve care. That's not what you do. You don't decide who deserves what. You decide what they need based on what their body shows you, and that's it.
Yeah, you got to find a solution.
Right. And one of the biggest solutions is we need to stop giving people medicines that otherwise don't need them. And then we need to make sure that we're giving the appropriate amount of medicine to the people who do need it so that they can have a quality of life that's worth living. Nobody wants to sit in the couch all day long. You know, nobody wants to just lay there hurting all day, unable to work, unable to go to a family function, unable to go to New Year's, you know, stuff like that. Nobody wants that. So we need to stop looking at people like quote unquote addicts, right? The whole 90s mentality of drugs are bad and good, you know, we got to get rid of all that.
I think because I've talked to quite a few people who are veterans, and a couple of them felt like they were addicted to substances, and I explained the difference between addiction and dependence and all that. But there are so many of them that started getting cut and then switched to subs. A lot of them were the switch to subs or completely taken off. And it's like they can't have a quality of life anymore. It's like this person literally served our country, risked their life, and gave so much time, and you can't even give them a quality of life once they're back. That's ridiculous.
Well, I agree with that, and I appreciate the sentiment for for veterans. But I think if we're going to be good humans, we kind of have to take that a step further and say this is a person with consciousness, and they feel distressed and they feel pain, they feel lost. They did just by the virtue of the fact that they are conscious and understand what's going on. If we want to be a medical system, we owe them a quality of life.
Yep.
And while we determine how to best do that, because we don't know, right? We don't even truly understand the way these drugs work in the brain on certain levels. I'm a big fan of Dr. Carl Hart, who he's written several works on addiction and the brain and all that good stuff. And it hits a brick wall where we're not 100% sure of everything we're doing inside the brain. But one thing is for certain when it comes to opiates, and I'm not admonishing you, but like I dislike it when we call them pain pills or painkillers, because while we do prescribe them for pain, we're doing a lot more than that. And we have to acknowledge that, right? We have to acknowledge that what we're doing is we're changing brain chemistry. So to a certain extent, yeah, we're activating a mu opiate receptor in order to diminish the amount of, calcium in the synapse and blunt the pain signal. But we're also changing brain chemistry, the pleasure centers of the brain, our dopamine, our serotonin, the circadian rhythms, how we eat, how we live, how we drink, the thirst reflex. Every bit of that is affected by this. And we have to acknowledge that when we're treating someone so that we can properly understand it when we decide we want to take someone off of it, right? This cold turkey thing it's just such a bad idea. It just leads to people going to a really bad place mentally. Like best case scenario, if they just detox at home, best case scenario, they still suffer a huge amount. Worst case scenario, they do like several of my friends. I had one die while I was on the rig. First week I was out, this last hitch, you get hurt, you get your medicine. There's no tapering. There's no patches. There's no nothing. It's just, okay, take this Vicodin or whatever 3 times a day, and then I'm just not going to fill it 2 months from now. And they turn to these ubiquitously available substances like fentanyl. And that's just the latest in a fairly long list of guys I know or served with or grew up with who have died from fentanyl. And we got to do better.
Then like benzos is another one. A lot of people are getting cut off cold turkey for benzos. And I had a cold turkey benzos myself. And that is not suggested.
That is so dangerous. It's like, not just from an addiction standpoint, but from a seizure standpoint.
I actually got diagnosed with epilepsy because I was having seizures coming off of benzos, and it was like a misdiagnosis almost. I'm fine now.
Right.
I'm fine.
Benzodiazepines are kissing cousins to alcohol in terms of the chemistry. So they affect the whole system. Gamma aminobutyric acid. I'm sure you guys are familiar with that because you guys are well versed in this. But for the people listening, when we begin to affect GABA, or what we call GABA, and it's an inhibitory neurotransmitter, when we begin to dumb that down, our body tries to overwhelm the drugs we put in our system. And then when we pull that sort of that chalk block out of our neural chemistry, and our body's been producing all this extra stuff, there's a rebound effect of extra activity in the brain. It's no different than if you stop your blood pressure medicine cold turkey, your blood pressure is going to go up, not just because it was high before, but because your body's been trying to overwhelm the medicine you take. The difference is, especially with benzos or alcohol, you can have grand mal seizures, you can have delirium tremens. All these things can end your life. So any physician who just cold turkeys someone off of these substances is probably not doing it correctly. But we also have to make sure that the physicians understand the way to do it. And when I see the addiction medicine doctors that talk about this and they're putting the information out, I get kind of angry because it's like, hey, here it is and it's free. Why are you not paying attention to this?
I used to have myoclonic jerks. I would twitch. It was horrible. And it got to the point where I got so psychologically messed up that I was calling in my own scripts for benzos because I was desperate.
Oh, wow.
Yep.
See, that's the thing. That's a position you never should have been put in, right?
Right.
Got
me in trouble. But you know what? It also got me to where I'm at today. So I can see, I'm grateful for that.
Well, I'm glad you made lemonade. You know what I mean?
Right.
But
not everybody has that. Not everybody could do that. And that's the part that I know we get so many messages, right, Kyle? People struggling like, hey, I just got cut off of benzos, cold turkey.
It's so
And then
crazy.
these people have to go right to the street, and it's like, ugh, it's not
Well, and
good.
yeah, I've seen that because the average person doesn't understand a lot of pharmacology, right? Which is not denigrating them. I mean, that's just if it's not what you do for a living, you don't know it inside and out.
Right.
They'll begin to substitute other compounds. What you get on the street, I mean, you hope you find prescription grade stuff, but do you really know that's what it is?
Right.
And then other chemicals make their way into your system, and you end up with this polypharmaceutical addiction that you don't know how you got into, and you don't know how to break, and your only real option is to go through, say, rehabilitation or something like that, which the average high and mighty self-righteous person views as, a lapse in character or something bad. When I think it shows a strength of character to say, look, I got to go away for a month, man. I got to be me. And then that's another thing that's got to change. We've got to stop as a medical community. We've got to stop putting people in this situation, but we've also got to sort of kill the stigma. Frequent flyers and drug seekers. I see these things on TikTok and they make me want to puke.
Right.
At some point in time, if you're a nurse or you're a doctor or you're a brain surgeon, whatever you are, at some point in time, you sat across the table from some people in a job interview and you said you wanted to be here because you wanted to help people. What the hell happened to that? You know what I mean? Like, where did that go?
Yeah, a lot of people lack empathy and compassion that work in the medical field. I'm sure you see that a lot.
I do. And it's just really, it's like being pulled in 10 different directions when I see it. Sometimes I see this stuff and I go, look, what you did was wrong. You need to tone it down. And then, part of my heart goes out to these overworked healthcare workers that are taught this stuff. And then part of it, and I'm not trying to take up for anybody, but hear me out. You take an 18-year-old kid and they're told their whole life, you got to go to college, get a good job, say put in a 401k, and they go, you know what? I love to be a nurse. That's the good job I want. They make decent money. I want to help people. And you put them in this corporate environment of Walmart medicine, which is what I call it, as cheap as possible, as fast as possible. And it's a toxic environment of overworked people. And this very, very influenceable 18-year-old, 19-year-old, 20-year-old kid with a nursing degree or a paramedic degree is now enveloped in this thing, and they're learning from their mentors. Oh, he's just fiending for dope. Don't do anything. And it's not to justify their behavior, but like, I get it. I get how a young kid could be influenced. And the reason I do is because I'm fortunate. I had good leaders. I had good mentors. I had people who understood that, when I was literally doing a physical on someone who had set off an IED and killed people, that is still a person and you need to treat them as such, and even though they're on the other side of the war, quote unquote, they're in custody. That means that they have all the rights of any other person in custody, and it's not your job to avenge anything. You are a healthcare practitioner, and learning those lessons young helped me. Because otherwise I feel like I would have fell into that trap, and I guess that's why I feel bad for the healthcare providers. But I think now we're at a place where addiction is so ubiquitous. It's so rampant in our society because of a million different factors that we have to get rid of our 1950s approach to people taking substances that alter their brain chemistry, right? We have to get rid of it, And I know I'm jumping all around. The ADD is bad today, so I apologize.
That's okay. What are your thoughts on, like, I've been reading the comments a little. What are your thoughts on, like, elderly people that are in the hospital and cannot get the pain medication that they really truly need? Like, you're up there in age. What's the chances that person's going to get an addiction? Like,
well, and they've probably been taking some of the stuff for years as it is.
And then all of a sudden they can't get nothing, and they're stuck there after a hip replacement with nothing.
I have kind of two directions I go in that. So the first one is, I don't think the goal of medicine is to save lives. I think it is to ease suffering. And I think clearly when you're in pain, be you elderly or anything else, then that's suffering, and we should ease that responsibly. But
yeah, like harm reduction. That's harm reduction.
Right.
Almost.
And so, when it comes to the medicine that people need, right? The human body will give you objective signs that someone's in pain. Like I talked about before, we sort of have this distress center in our brain. It gives off the chemicals. So even if you sit there stoic, you can physically look at someone during an exam and see that something's off. They're they're hypertensive, their blood pressure's up, or their heart rate is up. Things are off, right? And objectively, you can quantify that and then modify your dose to how they need it. Now, in the elderly, we worry about the organ systems being able to process such things, especially after a massive insult like surgery. But this is where the saying titrate to effect came from, right? You can use small doses and lead up to what you determine is the individual dose or whatever this person needs,
Right.
while trying to make sure, you use just enough to do the job, because whatever you walk up to in a pain medication, you have to walk back down if you want to be
Right.
responsible before you release the person. But this sort of hands-off approach, like don't touch it, don't give anybody anything, let them suffer. I'm not cool with that. Be you elderly or whatever. And when we talk about people who are, say, 80, going towards the end of life, I'm not 100% sure we need to be as concerned as we would be, say, with someone who's 20.
I agree.
Because opiate receptors, they change the brain. There's a diminishment in the amount of receptors that are activated by these chemicals. And then there's a lot of things that change. And if you begin taking a ton of stuff at 20, that's not going to leave you a ton of room later in life to manage your pain and live a full life. So that's where I would be. Yeah. That's where I'd be probably more conservative with it, like all things, in a perfect world. But when it comes to the people who probably won't survive, or the people who probably aren't going to live very long, I would try to give them the better quality of life for what time they have, so that they could leave good memories behind with their family. You know what I mean?
I agree with you 1,000%.
Yeah. In the end, that's all we really have, right? People they're going to remember what you did. They're going to remember how you acted. They're going to remember how you treated each other. And, it's genuinely, I hope that 95% of the people with whom I've interacted will think, you know what? He was okay.
Do you get a lot of red tape with like insurance companies and stuff like that? Like, is there certain things that you could do and can't do?
Where I'm at, no. I have a very unique set of circumstances in that there's an absence of specific litigation for where I am and what I do in federal waters. So essentially, it has to be top-notch medical care that can be defended in court, which honestly is a higher standard, to tell you the truth, because then you have to guide your healthcare by morality and not by legality, and the law has never been a good substitute for a moral compass. So
does it change if you move from one spot in the water to the other with the laws?
Yes. It depends on how many miles offshore you are. So I'm in deep water, where you put very experienced paramedics, because it takes hours to get someone out, no matter what the situation. Depending on the weather, it could take days. So my scope of practice is huge compared to when I was a truck medic. This is as close to what I did in the military as I could possibly do in terms of the procedures I'm allowed to do. And I did a video on this the other day. I ended up taking it down because you always got your naysayers. But we using an example, if you have something explode and gets impaled in your arm, as a medic on the truck, I'll stabilize that object. I'll give you some pain medication to sort of ease the distress and the anxiety, and I'll take you to a surgeon. As a paramedic on the rig, depending on what's affected, what blood vessels, the chances of nerves being involved, chances of bones being broken and stuff like that. If it looks pretty good, I'll open that and I'll take it out and clean it, put you on prophylactic antibiotics, and we may or may not medicate for pain. On the rig, things are different, because anything that affects consciousness, you have to be very leery of, because what if there's an emergency and you have to get to the lifeboat? Does that make sense?
Yeah.
Okay.
But no, we do give people the choice. So I might say, look, I can't give you a ton of pain medication for this. I can't. I can send you to the hospital, and I can get you a chopper out here. If you're in that kind of pain, I'm more than happy to do so. But subjectively, I need you to take stock of how bad you're hurting and decide what you want to do. Because I'm happy to do it either way, but I can't feel what you feel. So I need you to just take a minute, think about it, and tell me.
Now, if somebody has to fly out, do you fly out with them? Like, if they want to go to the hospital, are you with them?
Depending, yes. So it would depend. I've had guys I've sent out routinely. So let's just say like a tooth abscess, right? Happens to everybody. So you show up with a swollen face. I'll put you on like penicillin BK, which is sort of the go-to for abscess teeth. We can numb the jaw. So, use a long acting anesthetic and put it on the trigeminal nerve to kind of numb the whole thing to actually kill pain without affecting consciousness. And then we'll just put that person on a routine flight and send them out to a dentist. If it's like an active heart attack, I'm probably riding in with you, you know, because there's especially if you have to call like Coast Guard or something like that. Coast Guard medics are not well versed in cardiology. Military medics generally are not well versed in cardiology because it's just not something you see, right? Everybody's healthy. Everyone's an athlete. Even the special forces medics who have tons of training don't often have tons of experience with cardiac events because, I mean, you're healthy. You run 5 miles a day. You're a super soldier. So it can go either way. It just, the situation dictates. Whatever my patient needs, my patient gets.
I love that.
Yeah, right. Well, that's what we do, right? So we do have people who are first aid trained. Matter of fact, I invest in my guys. I'm an AHA instructor. So I'll train my guys or refresh them, keep them going. I've got a little team of guys with strong stomachs that if I have a bad thing and I need a pair of hands, that I'll have them come in with me, you know, just because I'm by myself. So they can do, you know, first aid or things like that, or we could send another medic out if we had to. But in theory, I shouldn't be gone long. I should go to the hospital via chopper, transfer care, and then come straight back.
I've always been so impressed with how like versatile your knowledge is, because you at least know a little bit about a lot of things, and I guess that's
it's true.
You have to for your job.
Yeah, you know, I think, what was the word? Passion breeds perfection or something like that. You know, the more you love something, the more you study it. And I learn a ton of things that I never thought I would use, except I've had to. And in this job, nothing is off the table. So I have to know all the classes of antibiotics and the different kinds of bacteria and their metabolism and how they work and what binds to what ribosome to fight the infection. It's probably why I love it so much, because the buck stops with me. Like, you come to me with a problem and I don't take you to the hospital anymore unless it's something I just can't solve.
What made you get interested in the cardiology?
You really want to know?
I do. I was
terrified of it. So, I left.
It's like a challenge.
Yeah, it was a challenge, but it was also, it was live or die. So I left the military. I could read blood work and do like cool stuff and manage kidney failure and burns and blast and ballistic injuries and infectious disease and parasites. Like, I was really good with that. And then I go to paramedic school and they tell me like cardiology cuts half of everybody out. And I said, what, really? You know, and then we jump into these classes, and I mean, it doesn't let up. It's like beating you with a stick. Scream all you want. They're not even going to slow down. You either make it or you don't. And I was terrified I was going to fail. I was out of the service. I had a young wife. We wanted to start a family. And I knew that it was all dependent upon me being able to continue to do more or less what I had been doing. So I just bought tons of books, watched tons of videos. That's how ShadeTreeCardiology came to be, because I was so fed up with this pay-to-play learning stuff that after I put enough letters behind my name and I could legally teach, that I started throwing things on the internet for free so that students could grasp them, because you're never more broke than when you're a student. And you have to understand that none of your military medical education transfers over. So I started school from day one like everybody else. I had things that I knew that helped me, and then I had things I had never seen before. And cardiology was one of them, and it terrified me. So when I find a weakness in myself, I attack it, because that if I don't, I'll nurture it, right? So I'm one of those people that if I coddle my weaknesses, I'll let them grow, and then they'll dominate me. And I learned that early in life. So I attacked cardiology and found myself, because I had already been a teacher, I'd already been teaching Iraqis, I found myself teaching my fellow students and showing them the things that I had learned and figured out and went through the lessons. And then the day I graduated paramedic school, the college hired me as an instructor. And
wow.
I was the cardiology guy. I mean, I already had 8 years in medicine, so I understood like electrolytes and depolarization of muscle cells and things like that. It was just unique to the heart that I wasn't familiar with. But given that I had this ability to explain it to people in a way they could understand, there was no way I was going to waste that, because we were losing half of our people in class to this subject. So, you know, I've always had the theory anybody can learn anything. You know, Einstein had a learning disability. So if that's the case, then why would I not share these methods I learned with other people in the classroom and online? And that's kind of how cardiology came to be. And, you know, I enjoy it too. It's wild. It's wild how we work and how we run. I never, ever get tired of it.
We had Dr. David Alfrey on here. He's a cardiothoracic surgeon. Mm-hmm. You have to read his book, Saving Grace. And speaking of books, you have a book, right?
Right. Yeah. ECG Hero, which is sort of in the vein that we were talking. Let me write down his book really, really quickly, because I am
It
It's
is so good.
it is
So
amazing. And
good.
honestly, I recommend the audio version of his book. He narrates it, and it talks about life, death, and in between that he learned from patients.
Oh, I can't wait. I'm going to download that like right after this. I do a
You're
lot
gonna
of,
love it.
Yeah.
I'm curious to hear what you think of it.
awesome. I devour books, both read and audiobook, because I drive a long way to go to the rig. I live in North Carolina and drive to Houma, Louisiana. It's right at 1,000 miles because I need to be
Wow.
mobile when I get off to do podcasts and things with my business partner, Charlie. We're trying to bring education to the masses, so I have a lot of time to ride and listen to that. Cardiothoracic surgeons, like in terms of the hierarchy of medicine, they are the ultimate gangster, right? Because they go to
I
med
love
school like
him.
everybody else, but their residency is so long, and they dedicate so much of their life, before they can even be the new guy, fresh out of residency. And their understanding of what makes us tick is amazing. I've had the chance to work with a few over the years, and to me, those were my rock stars, right? So
Right.
those are the celebrities where I kind of fanboy a little
You're
bit.
gonna love him. You should
Yeah.
reach out to him. You and him would be a good. He's
Awesome.
amazing.
Yeah,
Awesome, man. I will never turn down to have a chance to have a conversation with somebody who can open my view and help me understand things better. You know what I
So
mean?
what made you want to write your book? Like just to help give back? And what is your book about?
Well, ECG Heroes is about the function of the heart and interpretation from an emergency medicine standpoint. So the interpretation of the EKG is the biggest deal in emergency medical services, being able to catch that cardiac event, because they're not all heart attacks, but they can predict life-ending cardiac events. And you have to be very in tune to these subtle nuances, right? Your patient is not obligated to be dying in front of you to have something wrong with them. And you don't want to wait that long, right? You want to
Right.
catch these things early. So myself and Charlie Swearingen, who is a critical care wizard, we had this idea. I remember we were talking about it, and I said, how we lose half our guys to cardiology and medic school? He said, yeah. I said, I want to stop that. I want to write a book that even the layman could process. And he said, that's impossible. Let's do it. And that was when we became business partners in that moment, because I knew
like
that this
that.
guy I knew he would headbutt a brick wall with me, because he understood eventually the wall would give. So what we did was we wrote this book with the intention of whittling it down to just the simplest terms possible, where a new student with a little EMT training could grasp these concepts. You can learn your $10 words later. That's fine. I love them. Hey, I love polysyllabic terms, man. I love sounding smart, thinking I'm cool, but that does not convey understanding. A lot of times, the more jargon you use, the less you understand something.
Right.
And we wanted to write the first of its kind text that would make it less intimidating, and that was why we decided to write it. I wrote that book mostly on the rig. So we would do 14-hour days, and I would, get off and shower, and then stay awake until midnight, writing, editing, adding my 2 cents on the end of the chapters and things like that. And then, back up at 4 a.m, and I would do that for 14 or 21 days straight, because we were just driven to get this thing out. And it's been a monumental success, both in the amount of copies sold. That's been great. But what's really been a success is how many people reach out to me and say, this helped me pass cardiology. I could not have passed cardiology without this. And
I was reading some comments in here, and people were saying your book's amazing. I was looking at the comments.
well, see, that makes me feel good, because I only have 2 hands, right? So I can do so much with 2 hands. But if I can train other hands, like the good I can put out into the world is exponentially larger, even though I'll never see it, right? And it's kind of like what Margaret Thatcher said, great things happen when men plant trees they know they will never sit under. And so if you let go of your ego and just say, I'm going to do this because it's the right thing to do, you can do a lot of good in the world. And I feel like Charlie and I have had an impact on that. And you know what? That'll make you smile when nothing else will. You know what I mean? Like, there's people walking the earth today that would be dead had we not dedicated ourselves and our lives to this. That makes me feel good, man. Maybe that's a little selfish, but that makes me happy, because that's what I wanted to do with my life, and I get to
It fills your cup up. It fills your cup up.
It does, but like how lucky am I that I got to do that? You know what I mean?
Right.
Like what a wonderful thing to have the universe grant to me. to put that good out there. You know, it's like hitting the lottery every day.
And that's why I think Marie and I love doing this and helping people in recovery and everything, just because there are so many people that reach out and they're just like, hey, I've never talked to you, but you helped me get off whatever. Yeah. And those are always the best messages. It can take you from a bad day to an amazing day in a heartbeat.
You know, I wanted to draw a parallel between what you guys do and that, because it service is service. You know what I mean? There's no hierarchy of serving your fellow man. You're not cooler or more important because you do X thing. Service is service. So when you help someone through the worst time of their life, you know, if anything comes after this, you have to get a good view in a good room. You must, you know what I mean? But, you know, it just, when you put good out into the world for no other reason than to do it, that's a great thing. And you feel good. And like she said, it fills your cup, you know? And once, I mean, if you want to talk about addiction in sort of a tongue in cheek way, get addicted to that. You know what I mean? That's a good way to live life. You know what I mean?
How did you deal with your time away from your family? That's one thing that I really would like to know. You say that you have a child, and being out, you were working 14-something-hour days. It's
easier now because I have a separate cell phone, and it works out in the Gulf. So I have 4G out there. I can FaceTime, and
that's good.
I do things. I bring souvenirs home every trip. It's a big thing so that everybody, you know, it definitely lets my daughter, who's looking at me right now, actually on the couch. It lets her know that, like, while Daddy was gone, he was thinking about you. I also Amazon things home while I'm gone, so that they show up, and it's like a special shirt for my wife with something she's liked, or a tumbler, or they just. I like that. It puts like a physical thing on. Hey, I'm thinking about you. Yeah, you know what I mean, and that helps. At the end of the day, you just suffer through it. Nothing fills the hole, you know, but just trying to make them feel better, I guess, is therapeutic for me. Then just continuing to work helps you to probably get through it. That's probably why you're constantly working. Yes. Yeah, that's a huge part. Yeah, I distract myself with what I like to think of as noble efforts, because it keeps the sanity. You know, because you can only drink so much caffeine, you can only lift so many weights, or run up so many flights of stairs for exercise before it just loses effect for the day. And now you've got to do something constructive. If you just sort of lay and stare at the ceiling and think how bad you miss your family, you're going to go out of your mind. Like, I'll be honest with you, this hitch was really hard for me because I was gone during Christmas, which that's tough for any parent, right? Yep. My wife is also born on Christmas Day. So I'm not just missing Christmas with my daughter. I'm missing my wife's birthday. And we have a tradition, because she's a twin. She never really got her own birthday a lot growing up, right? Because her joke is she had to share it with Jesus and her sister. So when we started dating, and every year since, I've taken like a room in the house, or I go out to the shop and everything's decorated and happy birthday, and all the gifts are birthday paper. There is no Christmas in her birthday. Oh, yeah, make it separate. Right. And I wasn't able to do that. So that hits harder, but you know, we do a lot of things for our family. We go through a lot of suffering. So my situation may be fun to hear about, but it's not any less than what other people go through. What is your timeline whenever you're going out there? Like, how long are you out every time you're there? So my standard is 14 days on, 14 days off. And of course, there's a day of travel. So I'm home on average about 12 days if I don't go work with Charlie, which I do every month, a day or two. I spend about 10 days out of 30 home, to be honest with you, right now, because I'm trying to just build this thing that I hope will become this self-replicating spreader of good in the healthcare community, because we need it right now. So between 10 and 12 days a month, I'm home. I actively work 14 and then travel. So, you know, in totality, it's basically 16 days are committed to the rig, with a day or two committed to EM Unplugged and ShadeTreeCardiology. So, you know, between 18 and 20 days a month, I'm actually working and not home. So I get about 10 days home, which everybody doesn't do. But, you know, I just live so far away that it takes that travel. You know what I mean? Well, and I'm sure whenever you're home, you make the best of it. Because we've talked about this before. Like, I do a ton of stuff. I do way more than I should probably. And I don't get the time with my family that I would like. So whenever I do get the time with them, you just make the best of it. That's all you can do sometimes. You do, but being gone can bring out the best in you. And I know people may roll their eyes, but if when I hit the door, I've got 10 to 12 days, right? I speak carefully. I don't lose my temper because I know I have precious little time.
Right.
And even when my wife and I have disagreements, because any two people who live under the same roof, that's going to happen. You're more careful in how you speak because missing this person is very fresh in your mind.
Right.
And that's not a bad thing. I think a lot of relationships could probably have been saved if people missed each other a little more. So
I agree, because a lot of people are just around their significant other 24/7.
Yeah, and you take them for granted, don't you? Like
Right.
you stop looking at them like this miraculous thing that absolutely made you lose your mind when you met them. And you stop looking at them like that and you start going, why are you breathing so loud?
Yeah, it's like a friend. They become a friend. They become just like another person.
Yeah, well, my wife Casey and I have had that discussion. Like, look, we don't want to be roommates. That's
Right.
not. We don't want to be guys who share the bills and occupy the same space. Like, I want you here because you want to be here. You know what I mean? And I think that we lose sight of that a lot of times. We get busy in life, or whether especially with things like addiction and things like that, they begin to cloud our judgment. Or anything else. I mean, the TikTok social media hole and the way it messes with your brain when you're arguing with people, you can forget what's important around you. That's hard to do when you're gone half the time.
Yeah.
How were things for you whenever COVID happened? Like, what was it like on the rig too, and everything? Because that had to be a different experience.
So I dealt with a little bit of COVID coming out to the rig. I wouldn't call it the aftermath. It was still active and we were testing. But most of my time with actual COVID was spent before I got into the oil field. And that was a nightmare. You know what I mean? Just the quarantine, the people dying, not understanding why, getting vaccinated. And the vaccine hit me really hard. I have osteoarthritis and an overactive immune system. So that was a nightmare. I was sick, like very, very, very sick. And I'm not poo-pooing the vaccine. It's just that was a calculated risk that I elected to take because I was neck deep in COVID and we didn't know what it was. So
Right.
moving forward from there, having been vaccinated going into the oil field, you had to get tested before you could go out. I had COVID tests on the rig. Every time somebody sneezed, you get this kind of eyeball because on the rig you all live on top of each other. You occupy these same living quarters and areas. So there's a unique amount of management that goes with it in terms of quarantine and stuff like that. But there's also sort of we can't fix this. So if it's on the rig, everybody's got it. I actually got called out early. I had to go to a drill ship because they had an outbreak of COVID on it, and the medic got COVID. And I got the phone call at 2:00 that afternoon, and 5:00 I was however many thousands of feet in the air flying back to Louisiana because they had nobody else. And they needed somebody who could work independently, and I had to manage that outbreak, it's a monster in terms of keeping track of the numbers and things like that, caring for multiple patients when you're basically by yourself.
Yep.
We actually took the medic who had COVID, and for the confirmed diagnosis, cases where we knew they had COVID, we employed him because it was like, this is what we have. So, you feel good, you're on the mend. I'm going to have you helping me with these patients.
Did you ever have a fear of flying? I'm very curious about that. Like, especially flying like in a helicopter and then getting onto a boat. That has to be an experience.
Not, you know what? Terrified of ladders, never been afraid of aircraft. It doesn't make sense to me either. I was riding Blackhawks in Iraq at 19, begging the pilot to swing it sideways.
Hey, did they ever swing it sideways for you?
Yeah. It's been long enough now. I don't think I can get in trouble. Hell yeah. They would give me a harness and I would hook to the floor. And I would send my mom pictures of like me hanging my feet out, over Baghdad. I actually have a picture of a rocket going by us. I was just being a tourist. That's what we call it.
I would love to see that picture.
I'll dig it out, man, and send it to you guys. It's a blast. It's when you're 20 or 19 and you're invincible, that stuff is laughable.
Fearless.
Yeah. Oh, man, I was. And you it's the environment too. You have that warrior mentality. of I might die today, but it'll be in a pile of empty brass, that kind of thing, that sort of macho bravado, fragile masculinity thing that's so popular with the young kids, and it was popular with me too. I'm not trying to act like I was a deep thinker my whole life, but so yeah, no, never been afraid of aircraft. Landing on the rig is unique because the rig moves, or a ship can move.
Yeah.
So that's sort of the way they drop down, and you're kind of paying attention. You get a little nervous. They land a little harder because sometimes if the rig is moving, it rocks into the helicopter. But our pilots, where we fly, they are rock stars. They
Wow.
are, matter of fact, we've got one who is she very much impressed me. She's in her early 20s. And she is just demolishing everything in front of her in terms of tasks and competency and just becoming a great pilot. And as I started studying to be a pilot, because that's something I always wanted to do, she just really impressed me. And then as the dad of a father, it gives me a lot of hope, because aviation is kind of a male dominated field. And then here comes this young kid, like kicking
I love it.
and taking names, like I'm landing on oil rigs and thunderstorms, like, and I look at my daughter and I get this kind of big grin, like, you know what? They're cutting the path for you, kiddo. Now you can do it too.
Right. You could do whatever you want to do in this world.
Damn Skippy. It's just, it feels better to know that some of the difficulties that were once inherent in that might not exist as she comes of age, right?
I love it.
In any parent, that makes them happy to know. I mean, you don't want your kid to go without adversity, right? Adversity is good for you, but like sort of the things that shouldn't exist, the racist or sexist or bigoted, that adversity shouldn't exist, right? We can get rid of that, and life is still plenty hard. You know what I mean? So it just makes me feel good to see that we have rock star pilots. You know what I mean?
So what's going on with the musician thing? I hadn't actually, I don't know if you've ever mentioned it in any of your videos, but I didn't know you did that.
So I'll post one once in a while of like me jamming on the guitar or something like that. Music is, it's always been a huge part of my life. Been a musician since I was a child. I would just go mess with these instruments and copy the sounds that I would hear, to piano, trumpet, bass, guitar, all the fun things. And, these days I play to play. I paint for the reason you should paint, so to speak. You know what I mean? I do it to do it because it's an outlet. I record a little bit of stuff like, for my daughter,
I like that.
Yeah. Well, she calls it daddy's music. I listen to really intense, heavy, orchestrated, complicated stuff, and I'll record stuff like that for her to, I'm like, here, the name of this song is Bella. This is yours. This is for nobody.
I love that. You know what? It gives her something to hear your voice when you're gone. It probably soothes her, comforts her.
I hope so. And I hope it's sort of like the is it Bannerman effect or Bannister effect, where once you see it happen, you know that you can do it too. You know what I mean?
Yeah. Yep.
You hear, like, if you hear like an amazing guitar solo on a record and you go, oh man, I wish I could play that. Well, chances are you can. Yeah, exactly.
Yep.
And that's sort of the mentor I try to be. I don't try to just be like like a philosopher with my daughter, like, oh, you should do this or you should do that. I'm more of a, hey, watch this, Dad, because I know that'll instill that confidence in her where she can just, grab the world by the horns. And if she has that confidence now and builds it while she's younger, by the time she decides what she wants to do, who the hell's going to be able to stand in her way? You know what I mean?
No one's going to be able to stop her.
Right. And that's what I want. I think that's what we all want, right?
Yes.
I want her to be able to decide and follow through with whatever makes her happy. I will not influence what she goes into. I will 100% influence the tenacity with which she goes into it.
That's kind of how I am, especially my boys. They don't ever want to do anything. Boys are boys. But with my youngest, she's very adamant whenever she wants to do something. She's like, I am going to do it no matter what you say. So I try and like guide her through that. But it's hard with kids because especially you seem like, obviously you wanted to explore so many different things. Has she done anything and wanted to explore something that you weren't into?
Yes. I bite my lip a lot. I've got scars because So long before I had kids, I didn't know what I wanted to do, but I knew what I didn't want to do. Right. I was raised in a bit of a traditional household, not poo-pooing my parents. I don't think they did a bad job, but I was the only person like me in my family in terms of the ADHD, the creativity, the fixation on things, and then trying to share that with people with no real grasp that they didn't care about it as much as I did. All that comes later. Children are not really capable of understanding that you don't view something like they do. Right. So as a parent now, having kind of gone through that, I approach it a little bit differently in that regard. I encourage her to do and tell me about it. Tell me everything. Tell me every detail, and I refrain from rolling my eyes. But every now and again, she wants to do dangerous things. And
Hey, who does she get that from?
Yeah, my wife would be pointing at me if she was standing there.
Right. I had to do that for your wife.
It's tough because you walk this fine line of wanting your kids to be safe. And then I have this sort of echo in the back of my mind that I've had since way before I had kids, where Neil deGrasse Tyson said, every kid's born a scientist, and then we beat it out of them. So I let my daughter set things on fire, and she has her own toolkit, and I let her get greasy when we work on the car, and I let her do those things. I don't say no when you're older, no when you're older. Like life shouldn't be an accelerated course that you take on when you're 18,
I love that.
That's just, it's good. It's good for everybody to learn, right? It's not bad for you. That neuroplasticity. And then the more she crams in her head now at this age, when it's so easy to fit things in your cortex, it's a foundation upon which you build exponentially in knowledge, right. Be it language or mechanics or, honestly, when she hits the teenage years here fairly soon, I'm going to show her how to weld. Why not? What could it hurt? You know what I mean?
I agree.
There's nothing wrong with it. She knows, she's got a conceptual grasp of how to change oil. I won't let her climb under the car yet. I'm trying so hard to let her do more of the dangerous things. There's just something about climbing under the car. And then like vehicle maintenance and stuff like that. I've always done that myself. I don't think anybody will pay more attention.
Because you know what it is? You know what could happen.
Right.
And that's what's going through your head. And it's like you can't stop those thoughts.
Oh, no. Yeah, those intrusive thoughts are bad.
Right.
But like a good example is my wife's brakes. Nobody touches those but me. Nobody's going to pay as much attention to that as I am, right? Nobody's going to care as much about that. Because, if you lose your brakes, and that's just one of 100 different things. But I encourage her to come with me. And she is my buddy, my partner in crime. It drives her mom crazy. And bless her for having the patience to
right.
to let me take the kiddo out and let her, shoot a gun or light a firework or set something on fire or, different things like that, because I think she knows it's good for her. And she also knows that some kids have a spirit of adventure, and you can all you want, try to get it out of them. It'll never leave.
Yeah. You can never wash it out of them. They're born with it.
No, you have to sort of teach them how to take on dangerous things responsibly, as crazy as that sounds. It's harm reduction. It's like anything else, right? Yep.
Did your ADHD ever get in the way of your learning? Like when you were trying to do that accelerated course, I know it had to be difficult.
Not really, actually. So here's the weird thing. If you give me one thing to do, it'll take me all day to do it, and I'll half-ass it, right? If you give me more than a human being could possibly accomplish in a day, I'll have it done by lunch.
That's when you're
like,
on your A game. Like you can't stop.
Right. I need that dopamine. I need that pressure. So because the pressure was so high in that course, like we could get a 200-page module and take a test on it. We could get it at, say, 7:00 in the morning. We'd take a test on it at lunchtime. I thrive in those environments.
In chaos. You thrive when the time is limited and it's like fast paced.
Absolutely. Which is why I think I gravitated towards emergency medicine. But
makes sense. That absolutely makes sense.
See, I don't think ADHD is a disability. I don't mean that in the way that it does hurt people, but it's not that ADHD hurts them. It's that the system in which they are trying to fit disregards them.
Right. Like schools, IEPs, stuff like that.
Right. The school system in America is largely built to train obedient factory workers and people who are very content to live very boring lives. That's what they want you to be, right? Just an obedient member of the soul dead consumer culture. You get your little bells that show you your classes, just like your break time at work. Like that's what they want. But there are, whatever you want to call it, genetic formations in the brain that make people unable to deal with that. So I was a terrible student in school. I mean, I made D's. It was horrible, unless I was really interested in it. And then I would show up on the last day and take the end of grade test and knock it out of the park.
I love that.
It was just,
and part of you knew you were going to knock it out of the park, right? Like you're like, I'm going to.
Well, when like, for example, senior English, when we're reading To Kill a Mockingbird and we're reading it out loud and I'm listening to other people read, I'm going to sleep. That's happening. That is not enough stimulus to keep me awake. And I ended up cutting a deal with the teacher. And the reason we had to read out loud was we didn't have enough books for everybody to take them home. So I cut a deal with the teacher on Friday. I said, let me have this book. I will bring it to you Monday morning. Monday afternoon, I would like to stay after school and just take all of the tests at one time. And she kind of gave me that funny eyebrow, well, if you think you can, Mr. Carr, but
yeah, to
devour a 300-page book takes no time. You know what I mean? Right. If you really like to read. And I do. I love to read. So they learned eventually that just my brain was just going to process it differently. And if they were going to give me homework, I wouldn't do well. So my parents, sort of not really understanding this gene I had because nobody else had it, they watched me go in the Army thinking this guy's never going to make it. And then I graduate with honors from this course. And it's not because I'm smart. It's because I was finally in my element for the first time in my life. And I just couldn't get enough of it. And
it's that fast pacedness, right? Like that constantly moving.
Well, yeah, their motto is see one, do one, teach one, especially when we work with special operations. And just for posterity, like I was not a member of the special forces, but given that I was comfortable around other cultures and could speak languages and things, I worked with them because that's the main job of the Army Special Forces is to train indigenous armies. And their motto was see one, do one, teach one. That's the learning pace you're expected to learn everything, whether you're taking apart a 50 cal and checking the headspace and timing, or whether you're doing horizontal mattress sutures to sew up a shrapnel wound. And I thrive in that environment. And it was great because every day I was picking up stuff that I could use to help people, which just made me super happy and had good leaders. So yeah, the more the pressure, the better I do. The less the pressure, the worse I do. And I'm
the same.
Are really?
I'm the same way. Man. I thrive in chaos. Like when it gets quiet, it's when I struggle.
So I have anxiety when everything's okay. Like moments of levity will legit give me headaches.
Like I can't sit still. I got to keep going. Even like I can't I can't watch a show in my house, like TV.
Oh no, no.
My brain doesn't work that way.
I wonder if that's where my anxiety is coming from.
That's where I feel mine comes from because I can't sit still. I got to keep going.
So let me tell you what made my quality of life better. Just in case somebody hasn't told you that, I started looking at myself like a toddler. You know how toddlers don't get tired. They go, drop, pass out face down on the carpet, sleep wherever they fall, right? That's me. You know what I mean? So I just work and do whatever I do it 10 times bigger than it needs to be because I'm going to learn something because there's a struggle. And like, we're going to do fireworks tonight. I went crazy. And instead of just,
you go above and beyond, right? Every time it's like,
yeah, but I got to learn something too. So I looked up a bunch of pyrotechnician videos and how to wire different fuses and things together to be able to do this. And I'm learning all this stuff as a part of it. And I get to put on a good show for people. So I sort of find this, there's a way to make people embrace your uniquity. You know what I mean? And that's sort of one of the ways I've learned to navigate that. And because I don't think ADHD is a disability. I think it's a superpower that the world very poorly
you can use that to make things like almost like I'm losing the word, but like it's a good thing. You can use it in a good way.
Yes, you have to learn how to use it. You have to learn how to harness it because it's not going away and you're not going to tamp it down. And so I've never met a Navy SEAL, a Special Forces operator, a Delta operator, if you guys are familiar with who they are. I've never met any of these super soldier warriors who did not have ADD. Not one. Wow. Every single one of them, that is the source of their, I say every single one, I shouldn't broad brush. There's always somebody, but their drive to do these superhuman things are almost genetic. It comes from that. And you know, when you think of soldiers, sometimes you have this tendency to think of like knuckle draggers, you know, sort of macho man, testosterone fueled. But when it goes to special operations, that is just not the case. These are genius level intellects who are also capable of enduring great pain. Their test scores are through the roof. The way they consume literature and film and music is insane.
Now, if you're joining the services, do they discriminate if you already have a diagnosis of ADHD from like a psychiatrist growing up?
I don't think they care. I'll be honest with you. If it weren't for ADD, the U.S. military wouldn't be as good as it is. That's just a fact. You need people who can thrive under that overstimulation, you know? Right. Now, I did work at MEPS for a while, or I was assigned. My duty station was at MEPS, which is the Military Entrance Processing Station, where I saw, it was actually the same MEPS I went through, which was kind of surreal. So I got to see how we screen candidates and be a part of the medical process of that.
I love that.
It was really neat. It's good to pull the curtain back on things in life and get a look, you know, at how it works. I never saw anyone discriminated in any way if they were physically and mentally capable of doing the job. And also in those days, ADHD wasn't understood like it was. That was back in the days where they were still just throwing Ritalin at kids as hard as they could.
Right.
Again, you know, that's one of the problems with psychology across the board is, or psychiatry across the board, is we're going to affect the behavior more than feeling, which is the wrong way to go. So seeing those guys learn how to harness it, or seeing those guys basically just not mention it, was what happened a lot. You know, you just, and you also have to understand too, that the military loves to recruit from the lower socioeconomic status Americans. I was one, right? So a lot of those poor kids don't have that diagnosis. They don't have many visits to a doctor.
Yeah, their parents aren't taking them to psychiatrists and psychologists and therapists and going through the medical system.
Right. And it was so poorly understood, and still is in the general population. Like I had an English teacher, you know, have a conference with my mother and say he needs to see a psychiatrist. There's something wrong with him. And it was, there's nothing wrong with me. Your class is friggin' boring, but whatever, I'll go. You know, I was like 10 or 11, you know, you don't have any choice in what you do then. And I remember sitting across from that guy, and you know, he was like, "Why do you think you're here?" I was like, "I was kind of hoping you could tell me. You went to school. You know, I don't think there's anything wrong with me." I was very abrasive when I was younger. And I resented being there. There was nothing wrong with me. You know, I could pass all the tests. It's just, I just wasn't going to do the homework. And if it was boring, I wasn't going to stay awake. And that was just how it was. Like we had corporal punishment in my household, you know, so they were kind of hands on with it, but I just accepted that. I would rather take an ass whooping than listen to somebody drone on. And, I
can relate to that.
Right. I'd begun to resent the system that resented me, you know?
Right.
And coming out of that, after he spent all that money, I don't know if my mother actually got a diagnosis of ADD. Probably did, but she was one of those people that is you knuckle down, you make it through. Like if it's not going to kill you, you figure out how to manage it. That's how the world works. The world doesn't care that you're suffering, you know?
Like she didn't coddle you.
No. Now my mother was supportive and loving, and she was definitely, I mean, I'm 40 years old. She still gives me the hug I need when I need it.
Yeah.
But there was also you're going to have to endure this. This is how it works. This is the world. And if you shy away from every challenge, you're going to end up nowhere. And my father was the same way, you know? So I thanked him for that, but I get how a lot of kids fell through the wayside going through the school system in the 90s and things like that, because it was just so poorly understood.
Yeah, I agree.
100%. What's your opinion on what should be done for SUD patients whenever they have like a pain management situation where they don't want to get back on pain pills, but they need their pain managed in some way? What do you think is best for that?
I think we need to start looking at medicine through what's good for the patient and maybe not what's good for the checkbook.
Right.
And people that are in that very unique situation should not be sent home with a bottle of medicine, right? Ask me how I know. So that is something that should be done, in my opinion, maybe more inpatient and hands-on with very structured doses, because a person can lose everything through addiction and ease back into it accidentally because they were given medicine, right? I mean, nobody wants to, nobody means to. You know how many times I fell off the wagon, with alcohol and things like that? I mean, good God, I would convince myself that all I needed was a drink to get through this anxiety attack or whatever. And the next thing you know, I'm hammered. So it's not a lapse in character or anything wrong with that person. It's just until they begin to build a life that is so far removed and their recovery is so complete that they could manage that on their own, that it would be better to keep those patients inpatient. And then also, you need to not throw the textbooks away, but if the standard dose of, say, morphine is 5 milligrams, let's try 3. You know what I mean?
I would say, that's my addict mentality. I was like, up it.
Right. So let's cut it and titrate our doses to get the job done and nothing more, to help a person with a broken bone or whatever. Because, there's no rule that says that if you were formerly addicted to opiates that you're not going to break both of your legs. Right. There's no rule. So we need to carefully do that. And it needs to be done with monitoring and empathy and hands-on. Stay in the hospital, let the person stay in the hospital until we're not doing any opiates anymore. Yeah, that's going to hurt us financially in terms of the hospital system. But you know what? I've crunched the numbers on that industry and I think they're going to be okay. I do. So,
I noticed whenever it comes to people tapering too, and I like that, using only what's needed. Because when people taper, I've watched people barely drop it all, right? They only drop a little bit, but they think everything is like miserable and they're in such a horrible way. You aren't doing bad, you just aren't getting high anymore, but you can't understand that because it's all you're used to. So the using as small as possible, I think that would work great for a lot of people.
Yeah, and that's the thing that, and I talk with people about this and we wrestle with it a lot, right? When we talk about tapering people down and getting them off of stuff, and this is all academic, but when some people respond better to tapering, right? They are able to mentally deal with the months-long state of depression that comes with that, because you have to remember that it's not just that you're not getting high, right? Your dopamine receptors have, in some cases, kind of been scorched, and they are used to these super high levels. So while you may not be experiencing withdrawal symptoms from opiates, you are still incredibly depressed, unmotivated, sad, and this leads to a host of things. And then some people respond better to just like an aggressive reclaiming of one's life through detoxification. And we need to be doing psychological assessments on those people to figure out what kind of person you are and how you're going to respond. So I've never shared this before in my life, but I will share this. I have osteoarthritis in every joint, in every major joint in my body, because that's what it affects. I'm in pain constantly. I do not take opiates. But for a long time, I abused kratom. And by abused, I mean I abused extract. I could take between 300 and 1,000 milligrams a day of extract, depending on what kind of day I was having. And while it did help with the pain, and I think to a certain extent, I understand it better now, but to a certain extent, I didn't understand what it was doing to my brain. But I was a person who responded better to white knuckle, right? Just this sucks, and I'm afraid, and I'm terrified, and there's adrenaline running through my body, and I haven't slept in 2 days, and I keep throwing up and all that. But I'm gonna respond better to that, because no matter how many times I tried to taper, I never could make it happen. And that's one of the
That was like me and Kyle.
Yeah,
See,
I was the same.
We're different. We've got to stop putting a one size fits all on how we manage addiction and getting people able to reclaim their life. These methods are as unique as we are, and I'm glad that we're unique. If we were all the same, it would suck. You know what I mean?
Right.
But we've got to respect that, and that's one of the reasons. And that was why your video, Kyle, hit me so hard. Was, do substance abuse counselors need to have walked that road? Well, I mean, in my opinion, yeah. You need to understand that better. Once you've been in the belly of the beast, you get it.
Right.
You know what I
I
mean?
feel like we need balance. I feel like we need both.
Absolutely. And there's some really good stuff out there. So just, and I hate that we're running over time, but for example, that adrenaline, the panic attacks, the scary things that happen both with benzodiazepines and particularly with opiates can be managed with blood pressure medications like clonidine, right? So clonidine turns off the panic attack. It turns off the adrenaline section with no real psychological effect. So while you will deal with the depression and the sadness, at least you won't feel like you're suffocating, right? You'll actually be able to sleep. And then there was a study that came out of Iran, which people have a tendency not to respect the Iranian medical establishment sometimes, but you need to understand there's a huge amount of opiate abuse in that part of the world because it's freely available. There's no laws that regulate it, right? So were it not for poppy fields, the Taliban would have no money. So they deal with this consistently, and they found that using a simple regimen of things like clonidine, which is essentially a blood pressure medicine that turns off the adrenaline, combined with dextromethorphan, a cough syrup medication, just in a quite a bit of a higher dose, can turn off the negative effects that spur these panicky reactions where you will then be spurred to use, right? Because that's when people break. You don't break when you're at home and everything's good and you think, man, I wish I felt better. You break when you panic, right? You break when you're scared. And if you can just cut those instances out, none of it being with narcotics, all of it being cheap, which is the medical establishment should love, then you can get rid of that. And there are people who are going to respond better to that. But what we need to do is the research that lets us find out whose mental state is ready to go in what direction, and then take them in the proper direction so that they, one, have a greater chance of success, but then two, don't have a failure to regret, right? Because that hits addicts really hard when you make that commitment, like I am done with this shit. It's taking too much from me. It's taking too much from my family. And then you don't succeed. Like you feel so small and so bad and so powerless. And that makes it even harder to get up the gumption to quit the next time.
Yep.
And we could get a first time pass rate that's respectable on this if we would start looking at the person and their mind, where they came from, and just collect all this data. We could develop individual formulas. And the opiate problem's not going away. The benzo problem's not going away. Substance abuse only amplified because of COVID and the isolation and the uncertainty and bad things. So we have not just a responsibility to the people that we treat, but we have a plethora of data. We just have to go collect it, and we can help people and turn this into something that we talk about, like polio. You know what I mean?
Sure.
Like how great would that be to talk about opiate addiction, substance use disorder, like we talk about tuberculosis, right? You know,
the shame, the stigma, it has to go.
Yeah, it has to go. You know, leprosy was like that, right? If you had leprosy, God had struck you because of the sins of yourself or your ancestors. Of course, now we know that's not true. And in time, in decades, we're going to understand that people who have an addiction, that's not a shameful thing. They weren't a hedonist. They weren't weak. They had a very particular set of circumstances that led them down a road. It could have just as easily have happened to you. Yep. And it could happen to anybody. And that is evidenced by the fact that it's happening to more people every day, right?
Yeah, like you could get into a car accident today and your whole life could go backwards. You might need to get pain medications that you never thought you would need to take. No one's exempt.
That's what killed my friend Michael. And so he was in a wheelchair. He had just had a bad car accident driving to work on the interstate, 70, 80 miles an hour, and a car rolls. He had multiple broken bones. He was in a wheelchair. 90 days after the wreck, he had not been able to work. He was out of vacation time. He lost his job. What happens when you lose your job in America? You lose your healthcare insurance. That means you lose your ability to get pain management or physical therapy or anything. And what do you think he turned to because he could afford it?
The street.
Right. And he died. He died because it was a non-regulated pharmaceutical. He had no knowledge of how to take care of himself. He never should have been put into that situation.
You're right. They put him, they led him into that situation, the system.
Yeah, they did. But see, in his particular case, he wasn't even healed yet. So dependent, medically dependent, but like abuse and addiction, he hadn't even had time to get there yet. He just, while his bones healed and the pins set, from the shattered pieces of his body while the nerves were screaming, he wanted to catch a good night's sleep.
Wow.
Nobody should die for a nap, man. Not in this country, not with our GDP. not with the expertise that we have. It's funny that we're like the center for all the medical progressive and research and all that, and yet we let people die like that. Never should have happened.
Marie, did you have any last questions?
No, I just wanted to say thank you so much for coming on today. Honestly,
Yes.
I feel like we could continue this at another time
I know.
because
It's been
there's
fun.
so many more things that I would love to learn from
Yeah.
you.
Hey, you know what? I have thoroughly enjoyed talking to you guys and hearing you. And I tell you what, if we do it again, I'll try not to dominate the conversation so badly. But I was so motivated.
No,
to talk to
you were
guys.
perfect. Like so many people were given very good feedback in the comment section. And I
Yeah.
know it's New Year's Eve and I know that you're with your daughter and your family. So thank you for taking this time to give back like you've given back so many other times. And thank you for your service.
Hey, thank you for granting me the opportunity to help people, and that is what is so great about platforms like this and people like you guys. I'm trying not to get emotional about it, but nobody can save this thing but us. The corporate section is not going to do it. So anytime you guys want me back, 100% count me in.
Thank you.
Thank you guys.
Thank
Have
you.
a happy new year. Okay.
You too.